Sarah has already asked you to enter your name into the chat box. So if you could enter your name, your organization, and your contact information, we are grateful you are part of this, and we would also like to keep you informed of other upcoming things related to mental health, especially youth mental health. We have a lot of things planned through this next year. Our work, and Quinn has been a big part of this, is we have a strong project going around youth mental health and how to support them in living healthier, thriving lives and preventing their death by suicide. There is a steering committee that is working together that has leaders from across our 4-county district that is supporting and influencing, and then we have many local people that are getting engaged. And so anyone on this call that if you want to be part of that, please let Sarah or me know. That would be great. This project is funded through a maternal child health grant that is helping to address across the state the needs for 10 to 19-year-olds that have been dealing attempted suicide or dying by suicide. So we want to make a difference in that, and we all have a part. And with all of you joining, that just gives a great message too, that there are many of us that want to make a difference in the mental health in those around us and in our communities. So again, thank you for joining today. And I'm very grateful, Sarah and I are very grateful that Quinn was accepted our invitation to share on this topic today. It's something that's very important, and many have expressed interest in improving in our communities on this topic. Part of our overall goal is to reduce stigma around mental health. So Quinn, so glad you're here today. Quinn Lewandowski is a senior research specialist at the University of Nebraska Public Policy Center, where he serves as the project director for the 2019-2024 Samsha Garrett Lee Smith Youth Suicide Prevention Grant. He also serves as president of the Nebraska State Suicide Prevention Coalition and as an executive board member of the State Local Outreach to Suicide Survivors, LOSS, Coalition, and the Lincoln Lancaster LOSS team. So he comes to us with great depth of experience and wisdom to lead us on this topic today. So thank you, Quinn. I will leave it with you.
Well, thanks everybody for joining today. I see a lot of familiar names and people joining today. I got to say, Melinda Lewandowski, love your last name. So that's a plus. So already starting off on a good foot. I apologize in advance. I'm getting over, one of those wonderful summer colds that a young child can bring home to your home. Please excuse me if I seem a little bit stuffed up or have to take a break to drink some water or etc. So I'll share my screen here real quick. Okay. So jumping right in. So I wanted to first off say that today, of course, we'll be talking about suicide and mental health. So this presentation does cover some potentially sensitive subjects for folks. I really want you all, especially if at any point that you need to take a moment for yourself, for your own self-care, please prioritize that. And again, if you or someone that you know is struggling with suicidal thoughts or a mental health crisis, whether now or in the future, please remember that the National Suicide and Crisis Lifeline number is 988, and people are standing by 24/7, 365 to assist in whatever way possible. All right, now to the fun stuff, the disclaimers. So again, I'm happy to give this presentation today. Opinions expressed by me are solely on me, and not a reflection of my employer and the organizations that I serve. I also want to remind folks that, especially it seems like when we talk about language and other things of that nature, it can get political. But today we're not really talking about political correctness. We're not trying to be overly cautious with our language or and especially when we're talking about safe messaging in our language, we're not talking about avoiding certain words or phrases, etc. What is really rooted about our presentation today is using person first language. And especially when I say person first, recognizing that we are all individuals, we're all people, that especially those of us that and those of us as well as those that have a mental health condition or have had suicidal thoughts or an addiction, etc., are still people at the end of the day. So we're really talking about some really key components, and that we're all individuals beyond our diagnosis and conditions. So yeah. Again, here's kind of our learning objectives for today. I won't reiterate those, but kind of moving forward, I first wanted to start off in working with Four Corners Health Department. We had the fortunate part of in 2022 doing it in kind of 2021, doing a community survey, kind of talking about asking people in your community, what are those key things around mental health and talking about suicide. So here's some key quotes that especially have kind of helped spur good conversation and we continue to address today. So this is from a community member. Mental health just has a bad reputation. Everyone associates with the negative, so people don't want to talk about it. People are scared to reach out about it. I know my child struggles with wanting anybody to know that they see a counselor. It really bothers them a lot because they feel that they would be singled out or made fun of. So as a parent, if you're seeking that kind of information in a public forum, then because of the way behavioral health is looked at, it's almost like you admit that you didn't do a good job raising your kid. You end up finding a more private forum like social media to talk about what to do. So in kind of addressing that stigma and other things of that nature, we're continuing to improve our language, having dialogues about suicide and mental health are really important within our communities. So one key great fact is that about 67% of adults in the United States believe that they have had a mental health condition at some point in their life. So, and just reiterating that means that, especially like oftentimes we think of mental health as this some rare thing, but oftentimes, there are times in our lives that a lot of us have gone through depression. Some of us have anxiety and deal with anxiety every day or live with anxiety. So, especially with that. So again, suicide and mental health are important issues in our community. I think we all recognize that. I think that's why everybody's here today. But it's especially important as a community, as a state, as a nation, we continue to talk about suicide and mental health and continue to improve how we address each. And again, from that same Four Corners survey and focus groups, people need to know how to talk about it. So kind of leading into our next portions. So why are words important? Why is our messaging important? So whether we're talking to coworkers, friends, family members, or we're creating a social media campaign for our area, when we approach the topics of suicide and mental health, it requires sensitivity and empathy. So we don't know everyone's story. We don't know everyone's background. But especially just being mindful and using different phrasing and other things of that nature can make a really huge difference. And again, in that second portion there of our understanding of suicide and mental health, deepening our language adapts accordingly. So suicidology, or the study of suicide, is still a relatively young field. And when we think about psychology too, like obviously over the past few decades, things have evolved. We've learned a lot more. We've studied how our language, or like how media reporting of suicide has and mental health affects certain things. And especially what I bring to you today are best practices, or what we have right now, or the best way to put it as evidence informed instead of evidence based. I like saying evidence informed now a lot more, because informed means that we leave more to, there might be something in the future that we discover that continues to improve. So being informed means that we leave the room to, if there's more proof or more evidence that points to a certain different direction, we're happy to correct it. But as of today, this is it. Like, this is the best practices that we'll talk about today. So why is messaging important? One, it can promote positive behaviors. Two, it can help promote help seeking, which is really, really key. It can support prevention goals, decrease barriers, and be encouraging and hopeful, and really promote recovery. But our language can also contribute to increased risk, undermine prevention, and increase barriers to help seeking, as well as reflect our own personal judgments and or opinions. So it's kind of one of those things, it can go either way, and we're a big part of that conversation. So as we continue to talk about suicide and mental health, it's really important that we follow some key tips and guidelines as we address this within our communities. So especially when we look at suicide specifically here in the state of Nebraska, and I promise I won't get too far into data and other things of that nature. So looking at suicide in Nebraska from 2016 to 2020, a nice 5-year range to help capture the fluctuations. As a state, we averaged 14.4 deaths per 100,000 people, which is right in the middle of our country as far as death rate or death rates by suicide are concerned. As you can see, all those areas are segmented out by public health department district. And then you can see the number, there's a number allocated within that area. So that's per 100,000 people. And that's calculated so we can better compare areas. So obviously up in north central Nebraska has a lot different population than Lancaster County. Same with the Omaha area versus the Panhandle. So this is a great way for us to look at how trends and rates are affecting our population. So, but this is a really key topic. So in moving into the framework for successful messaging, there are basically two really key components. The third one, especially guidelines, we'll talk a little bit more on that. But all this is encompassed in that strategy surrounds it, that we're really intentional with what we do, what we say, and what we put out into the community. It's important for me to reiterate that even as professionals and seasoned professionals, we are human. We make mistakes. We might slip up and say the wrong word. Like, that's okay. Like, but I think the important key thing is that we continue to talk about suicide and mental health within our communities, and really do it in a profound and sincere way. Again, I make mistakes. I've heard the most seasoned suicidologists in the nation use words that we don't use anymore on national webinars. So it does happen, but we'll talk a little bit more on that forthcoming. So first off, we want especially our language to be based, be safe. We want to have some safety there. So there's a large amount of evidence that shows that, especially of how we message about suicide and mental health does affect people, especially in the media. So especially using the correct words and terminology, as well as more person-first language and some of these other key components that I'll talk about coming up. It's important that we're safe. By having unsafe messages, and especially we saw this more recently in the past few years, like with the death of Robin Williams, there was so much coverage of his death, and it was a mix. Everybody was talking about it, and some even more reputable news organizations were doing a terrible job and very reckless with their messaging. Other examples, the Netflix series 13 Reasons Why really kind of delved into some unsafe messaging, and especially on that, there's articles that talk specifically about that. So there's some certain things, and we consistently make mistakes in what we do. But as we continue the conversation, the media has developed guidelines and other things of that nature of how they report, as well as how we address and talk about suicide within our communities, whether in the media or in person. So our language and messaging should promote actions that people can take to help prevent suicide. So especially when we're talking about suicide and mental health, one of the key things that we can do, we can remind people that the National Crisis Lifeline does exist. So that 988 number is there. It's easy to remember now. And it's more than capable of helping people begin their journey or their road to recovery, or it can help them deal with a situation with a loved one or a friend or anything of that nature. When you struggle to find the words to say or the right words to say, 988 can help. The other things that our messaging should do, it should really enforce that prevention works, that resiliency and recovery are possible. It should also reflect our respect and unconditional positive regard that things can get better, that we can make a difference with prevention. Also, it's a great reminder that there are effective programs and services that exist and are out there. And above all, that help is available. I think that's really key, especially as continuing those reminders to those that may be struggling, whether with mental health or thoughts of suicide. I think that's key. So those are great things to remember. What we should not be doing is focusing on diagnoses, deficits, stereotypes, and labels. So stereotypes that someone with a mental health condition is dangerous, that they're unemployable, etc. There's all sorts of different stereotypes that many of you may have heard or grew up with, other sorts of things. We should not show or describe suicide methods or locations. We should steer away from that. Glorify or romanticize suicide. And we saw this especially a lot with the example of the 13 Reasons Why. It really kind of glorified and romanticized it in a way, which can be particularly dangerous with people at risk. And that's especially some of the things that we're steering away from, is especially keeping that out of the minds of people at a risk. It should also not minimize suicide. Suicide is a very impactful and very painful event for families, loved ones, and beyond. So we should not minimize it in any way. as well as we shouldn't use data or language that suggests suicide is inevitable or insolvable. I think all of us can really focus on, like, there is help, there is hope, and people really do care uh, about you, about others, and other things of that nature. Also, we're not trying to oversimplify causes. Not oftentimes as humans, we like to oversimplify something. We want to find out the root cause of why my my front lawn looks so terrible, especially in the summer. It's probably because I don't water it, but there are also other categories. We as humans, we like to find one singular cause, one thing that we can point our finger to and say, that's why. But I think we need to realize that with suicide, which is a complex issue, as in many things in our life, it's complex. There's a lot of things that go into why somebody considers taking their own life, and the cause of suicide. So yeah, so those are some key points there. And moving forward on why we want to promote a positive narrative, especially when we communicate with media and other things of that nature, we're really hoping to change the narrative. We want to promote hope. I think that's the key thing there. Promote hope, connectedness, social support, resilience, treatment, and recovery. All these are really great things, and we know that these are really great things to somebody that may be struggling. So it's important that we remind people that these exist. Oftentimes, and we can probably have all admitted this, that sometimes the media can seem really negative, and convey negative narratives. So especially going against that, let's really promote the positive. Like, if we're going to talk about suicide and mental health, we really need to be talking about the things that are out there for our communities, the people that are out there doing their jobs day by day to help us move along the pathway to recovery. So lots there, but especially in more examples of just the positive narrative, and you can read through those there. But concrete and realistic actions that parents or people or any particular audience can take. It's important to remind people of warning signs, resources that they can go to, phone numbers like 988, and other information needed to act. Especially, and you can maybe think back and think of things I've already said within this presentation that are good reminders for folks. Examples of effective prevention and intervention efforts. Yeah, it's really important that people know that there are things out there that work. There are methods, there are programs, other things of that nature that help people get better. Same with effective treatments, programs, and services. The other little thing that, especially stories from people with lived experience. As I've said many times already, everyone has their own story. There are people that are living through having a mental health condition. There are also people that have experienced suicidal thoughts, or have experienced a suicide attempt, or have experienced a death of a loved one, or a friend, or a coworker. Those lived experience stories are really important. I think it's really valuable, and I think we can say that there's nothing more relatable of, when we're scrolling or going through or meeting people. It's nothing like finding those common lived experiences. So people talking about their recovery or their road to getting better really is valuable. And oftentimes we don't highlight that enough. So there's a great website that's put together called Live Through This, I believe .com, and Sarah can maybe or I can look through on the internet in the background and find that link. But it's a really powerful, well put together website of people that have that have experienced thoughts of suicide or attempts, that goes through their stories and how they got better. So it really cool, really well put together. Really strongly encourage people to check that out, kind of look at that. So it's a really powerful website. And I think with the third component of especially our framework is guidelines. So especially as you're messaging or putting out media campaigns or anything of that nature, I think the key thing here is that people have done this work and have discovered best practices along the way. So there are lots of great things out there that you can see or copy or take lessons learned from. And that suicide messaging or suicide prevention messaging, .org website has a lot of those great guidelines out there. So all sorts of great things out there. I think that's the key component, that especially if you're looking at messaging the public or talking with folks, that things are out there. There's good resources that you don't have to reinvent the wheel with. There's some good things out there. So and kind of moving forward, and I first off want to thank especially Centerpoint for their great community, but they have this great language guide of things that they practice with all their employees within their organization. And for those of you that don't know Centerpoint, they're here in Lincoln. They want to run a wonderful crisis line, and well as work with a wide variety of people here in the Lincoln surrounding area. So a lot of what's next referenced is in there, and Dr. Ryan Carruthers was especially excellent and especially give me a glimpse into the clinical world as well with this. So we sometimes talk in general terms like patient, client, consumer, other things of that nature. And this might sound familiar for some of you that may work in healthcare. But at the end of the day, we're really people, persons, family members, individuals, friends, or even our chosen name. We oftentimes like being referred to that more than being a business label. We sometimes focus on labels and diagnoses. Again, we want to put the person first and focus on their struggle. Kind of separate, and we'll get into examples, but separate the person from their diagnosis, their person overall. We generalize the symptoms of an individual. Oftentimes we do that. So especially a lot of us that have lived experience know that things aren't exactly the copycat the same as somebody else's experience with like anxiety. We all have our own difference, and our brains are pretty complex things, and how we live and experience things are often very different than other people. We can sometimes use stigmatizing and condescending terminology. So we really want to migrate to using destigmatizing terms as well as empowering terminology. We'll get into examples here shortly. But first, especially when we talk about language examples, so oftentimes, and we've all heard this throughout our lifetime, and especially it was a very commonly used term, even just 10 years ago, of commit or committed suicide. Instead, we should be using died by suicide, death by suicide, lost their life to suicide. And especially in getting away from commit, we're getting away from that stigmatizing kind of thing of committing a crime, committing a sin, kind of reinforcing that stigma that it's a selfish act. And really we're getting to more terminology of what it is. They died by suicide. That really helps strip away that shame, blame element. Other things, successful, unsuccessful suicide, completed or failed suicide. So died by suicide, again, survived a suicide attempt. So especially we're again, and you can kind of see the reason why there, the notion of successful or as an achievement, or framing it as some sort of achievement or something that often we use in a positive light or a matter of fact way. And when it comes down to a suicide attempt is either fatal or is not. And especially those that have attempted, you don't want to continue like if someone lived from a suicide attempt, we're not saying, oh, you failed. Like when somebody's at their lowest, I don't want to use the word fail or unsuccessful or anything of that nature. They had a suicide attempt and that's what it was. But life can get better and they can get better throughout their recovery. So really, really separating that and getting away from that terminology of it being an achievement. And then especially, I think we also need to think of and remember that we're not, a person isn't defined by their mental health condition. Just as you can see that example right there, just as we wouldn't say someone is cancer, we should avoid saying someone is bipolar. Instead, use language as have, live with, or experience a mental health condition. By including that more empowering and hopeful language, we can help foster a more inclusive environment, especially when we're discussing mental health. So getting into a few more language examples, of course, we've all heard some form, whether in media or otherwise, of some of these words. But again, saying living with, has a diagnosis of, or lives with, we're really getting away from sensationalizing mental illness and reinforcing stigma. So especially, again, separating from the person, there's a person there, the person's first, their mental health diagnoses or what they're living with is secondary. So all right. So instead of saying suffering from or affected with, like being treated for, or someone with, again, this is just helping get away from the stigma that there's a lack of quality of life. You know, especially I live with anxiety. It's great, and especially with presentations, you know, that's super awesome. But it's something I live with, and I live a great, wonderful life with great friends and great family and other things of that nature. Anxiety is just something I deal with. Sometimes I get nervous. That's all right. I live with it. I manage it. It's great. But it also has enhanced my life and no way hindered me. So blank is suicidal. So instead, where blank is thinking of suicide, blank is feeling suicidal, blank is experiencing suicidal thoughts or feelings. So again, we're not trying to define somebody by their experience with suicide. They are more than their suicidal thoughts. Of course, all these other wonderful words, crazed, deranged, mad, crazy, psychotic. We often use these types of words, and it's very natural and human. We like to shorten our language, as well as we kind of abuse some of these words as well in our daily life. And this is a great challenge, and I credit this totally to Dr. Carruthers of Centerpoint. How often do you hear somebody describe something as something is crazy? Like, man, did you catch that game last night? It was crazy. Like, more often than not, we use those words, and they're stigmatizing words, but when in reality, we're really trying to say something is wild, like, you know, oftentimes, I could say or a horrible example is like, I could say my dog is crazy, but in reality, she's really just a jerk that rips up my boxwood bushes. So like, it's more helpful to describe something as it is than to say something is crazy or use some of these other words. So a little poll from the audience, just kind of overall impression. So you have two groups here of different types of messaging. Which group makes you believe that suicide is preventable? You can shout it out or put it in the chat or whatever, and you can read through those. Yeah. So I think especially, yeah, 2 makes you feel like suicide is preventable, like things can get better, that there are people out there that care and there's help. You can see some in group 1 that are just like, man, suicide prevention, why can't we find answers? Like that doesn't sound great. That doesn't inspire hope. That really, a lot of these messages on the left really break that rule of the positive messaging. We're not really helping talk about mental health and suicide if we're not promoting some positive narratives that things can get better. So again, and just moving into some more practice, this is a great one. Oftentimes we say alcoholics, addicts, words that we can say that are person first centered, people who struggle with addictive behaviors. I think those that have struggled, and I've had family members struggle through this, like they're still my cousin, they're still my brother, they're still my sister or parent or whoever outside of their addiction. There's a person behind that. And by using that, especially of those that are going through recovery or trying to get better or other things of that nature, by framing it as something that they can beat or that they can separate or move on from, is so much more empowering than being called an addict or an alcoholic. It really separates and reminds somebody that they are human, and that this addiction, though is a part of them right now, is something that can separate entirely from them down the road if they work hard enough and continue on their recovery. Instead of saying mentally ill, they have struggled with mental health issues. Pretty clear and concrete. And I think as I continue to go down this list, you can kind of see how, especially on that left hand, we just love to be succinct. We're not really describing things as they are. They are a schizophrenic. They've been diagnosed with schizophrenia or live with schizophrenia. So another one, they are being manipulated. And I'm just tongue twisting on that today. I wouldn't call my toddler manipulative, still struggling, but they're more skilled at getting their needs met. That's a great way to put it. My daughter is excellent at getting her needs met and speaking her mind. So especially in framing that just a little bit different, makes a world of difference. So again, they are low functioning. They're having a tough time with that activity or skill that especially they see low functioning with. They are dangerous. They tend to be aggressive when upset. That's a way to describe it. They are unmotivated. They haven't found anything that sparks their motivation yet. They are manic and paranoid. So and seeing that, when in reality, if you describe, they haven't slept in 3 days and struggle with trusting others. That's a great better description of what's actually going on than saying they are manic and paranoid. They are being very difficult. We weren't on the same page, and it's a challenge for me to work with them. It's very often that we do the shorthand route, but oftentimes it's those little things that help us communicate what's actually going on. And again, wow, that's crazy. Wow, that's wild. Let's continue to work on that, and especially with that challenge, that's something that continually improves over time. Everybody slips up on that. In talking about different resources that talk about language, these are some great resources out there for anybody to access, especially more information on suicide prevention, as well as messaging when it comes to talking about suicide and mental health. The Suicide Prevention Resource Center is an amazing resource that helps encapsulate everything that touches on suicide and mental health. Cannot recommend that resource well enough. sprc.org is the website there. Of course, you saw notes of the suicide prevention messaging.org website throughout my presentations referenced, which encompasses the framework for successful messaging. It's a great one. Reporting on suicide, people can find that pretty easily. 988, the Suicide and Crisis Lifeline. There's some great messaging around there, as well as with 988 and its rollout. They've done a really good job of creating toolkits around talking about 988, highlighting 988, as well as all sorts of other good things. And the National Action Alliance for Suicide Prevention also is just such a great resource as well. Again, just a good reminder that 988 is out there, that people can text it, they can call it, they can log on and utilize the website to also chat with it as well.
So tomorrow, they're just all tomorrow is their
Really, I
show.
think you're unmuted. Or there you go. Perfect. So again, thank you again for coming today. That kind of wraps up my presentation. Any questions or anything that may have come up?
Yeah, please, you can put your question in the chat box, or you can just unmute and ask your question to Quinn. Quinn, you shared excellent content with us, and I love the specific examples of how we can take something we may have been saying and phrase it better.
Thanks, Chris. And again, like, we're all human, like we all have used or can use this language quite often, and I may have in fact slipped up in this presentation like sometimes, but it's by having this knowledge and talking about this and looking at some of the recommended best practices and really just putting people first.
When we have a question.
Yeah.
This is from Pam. What can individuals do on a local level to make a difference? Excellent question, Pam.
That's a great question, Pam. I think especially one of the things I always recommend for folks is to especially take a gatekeeper training, like question, persuade, refer, like QPR, or there's Safe Talk and other things of that nature that help give skills to people to help recognize the signs of suicide, and as well as have conversations with somebody that they may be worried about or concerned about. I love those types of trainings. They're always they're great to train, and it's great to have the conversation, and it also helps you have a conversation with somebody a little bit more openly, whether it be about mental health or you see somebody's having a tough time. It really helps open the door for those conversations to somebody that may be struggling, whether or not they're having thoughts of suicide or not. It really gives good practice and thought to just having an open conversation with somebody that's having a really tough time. Because oftentimes when we're going through a tough time, all we want is somebody to listen, more than anything. Yeah.
Yeah. Any other questions? Otherwise, as you're thinking about that, I would like to pull up the Four Corners page that has a lot of resources locally, statewide, nationwide. But please, as you have questions, please share those. So I'm going to take it off yours, Quinn.
Okay.
So you should be able to see our webpage. And you will see up here mental wellness, youth mental health. Just making sure, double checking. This is where Quinn's talk will be posted. You'll see on here that we have this graphic. We have then, if you could just click on that, and it'll take you to our mental wellness page. It has the 988 right on here, Boys Town. We have a local therapist here at Four Corners. And then here, Angel and Sarah have been working on wonderful resources. You can click or you can call. You can get a printable version. We have it dated. We encourage, if you could, post this on your organization's website. We will keep this updated. And then, so if you post the link, whatever link you share will be the most current version. We also, on our website, if you go to the main page, you will see a resource directory for multiple resources for counselors, local counselors, things like that. I'm going to take you real quick to this youth mental health page. Why is it doing that? Because here you will see a quick resource guide that I just showed you. Recordings of coping with unique needs of children with ADHD, autism, and moods. Quinn mentioned the report that the UNL Public Policy did for Four Corners, and the full report and the summary report is here. Our steering committee is listed here, and Pam for getting involved. There are things that you can do, so please reach out to us. We also have a campaign, Nebraska Needs You, and that's on our website also for finding ways you can print the materials. It's shareable ways for giving that positive message. Sarah, would you mind putting the link to the resources for the Nebraska Needs You campaign? Great. I don't see any other questions. I'm checking real fast. Great. So hopefully everyone's okay. We will be offering more of these opportunities. We have workshops coming up, and we also have some trainings coming up also. So please watch our website. Sarah, thank you, has been posting the links that Quinn mentioned. And now she just posted the link to the Nebraska Needs You toolkit, where we want people in the community to use these resources. So please do. It gives that positive message that there is help and hope. And it's for rural communities and our youth. Anything else, Quinn or Sarah, that you can think of?
I think more than anything, and just following up too on Pam's comment, especially if you're interested in getting involved in your community or your state, just again, continue to be the light and be the person that highlights some of these things. whether it's getting trained in QPR or sitting on, you know, or attending a local suicide prevention coalition or anything of that nature. I think that really helps. And I really applaud people like Four Corners Health Department, as well as like the Four Corners Loss Team or the local outreach to suicide loss survivors team. Like all sorts of great, wonderful people are coming together to help make a difference in prevention and postvention after we've lost great people. So I really want to highlight that there's lots of great active things, and this is a key priority within our state for a number of individuals just besides me. Especially it's always great to see a number of individuals even talk about or come to this, even though I don't see a lot of your faces. I know you're here for a reason, and you care about this as well. So it makes you feel that we're all working in our own way to make a difference. So yeah,
Yeah.
that's all I have. And thanks for dealing with my ramblings today, guys. Don't hesitate to reach out if I can answer any questions or be of any assistance or point you in a good direction. So
Great. Thank you, Quinn, very much. We're grateful. And many thanks to all of you for the work you currently do, have done, and plan to do in the community that keeps our communities healthier and safer. We want to join with you in the work you do. So reach out to us. Thank you, everyone. Great, I will stop recording. Oh, I did it.
well, thank you, Chris and Sarah. I really appreciate it.
It was great. I'm sorry, I'm playing here. I'm going to stop recording.